Alex. Today we're going to do a perio chart for you, and I just want to show you this chart that is actually a chart of the progression of disease from very, very healthy all the way down to advanced periodontitis. So when we do this exam, what we do is we take a little instrument just like this one, and it's marked off in millimeters, and what we're actually looking for is inflammation. So we measure from the top of the gum to the top of the bone, and in a normal, healthy tooth, that will measure 1 or 2 or maybe even 3 millimeters. It won't bleed. When we look at your tissue, it'll look really, really healthy, very pink. And when we look at your x-rays, we will see this light line right across here is real straight across. There's no change in the bone. That's very healthy. If you haven't had your teeth cleaned for a while, or maybe you're not doing as good of a job at home as you should, you might start to get some inflammation. That's called gingivitis. It's an infection of the gum tissue. So when I measure from the top of the gum to the top of the bone, it'll still be 1, 2, 3 millimeters deep, but it'll bleed really easily, and the gum tissue will look really red and puffy, but in the x-ray we'll still see there's no change in the bone. So if you start to get your teeth cleaner at home every day, get them cleaned here in the office more regularly, it'll go right back to healthy. If you don't stop it at that point, then we get into early periodontitis. So when we measure from the top of the gum to the top of the bone in early periodontitis, that pocket will be about 4 millimeters deep. The tissue will be really, really red. We may see some recession, and when we look at your x-rays, we're going to start to see a little bit of deterioration of the bone. Can you see how that looks a little bit different right there? It's just starting to change. If it progresses to the moderate stage of disease, when we measure the pocket, it's going to be probably about 5 millimeters from the top of the tissue to the top of the bone, and the tissue is going to be even more puffy and red. This patient probably has a really bad odor and taste in their mouth. And when we look at the x-rays, we're going to see a dip in the bone. That's where it's really changed quite a bit to a moderate stage. In advanced periodontitis, when we measure the pocket, it'll measure about 6 or 7 millimeters deep. There may be some pus that comes out of that gum tissue. They're very, very red, very, very swollen, bleed really easily. And when we look at the x-ray, we'll see that this patient has lost just about half of their bone. These teeth are actually loose because they don't have good bone support. So we don't want you to get to this stage of disease. We want to catch you in an earlier stage. So hopefully, when I do this little exam, you will hear 1, 2, and 3, no bleeding, and that'll mean that you're healthy. What stage of the disease do you think you might show up today?